Skin cancer is the most common cancer here in the United States, with doctors diagnosing more than a million cases every year. WNBC's Health and Science editor, Dr. Max Gomez, was one of them.
I was born in the tropics, Savannah, Cuba to be precise. In a lot of my baby pictures, I was at the beach. When we moved to Miami, still pretty intense sun, I played lots of sports, so I spent even more time outside. And in those days, suntan oil had no sunscreen, no SPF, no sun protection. My nose would sunburn, and I was a little kid, and I'd pick at the little sunburn in the skin, and it would, peel off and kind of bleed, and by the end of the summer, I had this sort of dark patch where I just kind of picked it raw there. In college and grad school, I added canoeing, kayaking, backpacking, more sun exposure. Add it all up, and it's no surprise that...
This is the area we did the biopsy on. Now, this was a little skin cancer. This is what we call a basal cell carcinoma.
I knew I was at high risk because of my sun exposure, so Dr. Bruce Katz has been checking my skin for years. When actinic or solar keratoses have popped up, pre-cancers, he's frozen them. But even under expert supervision, sometimes something slips through. Then over the last maybe 6 months or so, not only did it flake a little bit, but it got just a tiny bit raised or elevated. When you still finally hear that diagnosis, it took the wind out of my sails a little bit, partly because I also then knew what it implied, what I was going to have to do.
Well, I promise you'll have the smallest possible hole we can make.
That's some comfort, I guess, but I know enough to know that smallest possible could still be a pretty big hole, especially when it's on my nose. A biopsy 2 weeks ago came back positive for basal cell carcinoma, one of 3 main types of skin cancer. Basal cell is by far the most common, over 1 million cases a year, but also the least likely to metastasize.
Our cure rates to date are 99.9%. For basal cell cancer.
Then there's squamous cell cancer, only about 250,000 cases a year, but also more likely to spread. And finally, malignant melanoma, nearly 60,000 cases a year, but deadly, because it can spread when it's still very small.
We don't want to sacrifice any normal tissue.
The best way to minimize the amount of normal tissue cut out is with a technique called Mohs micrographic surgery. Dr. Michael Album starts out injecting my nose with local anesthesia. Then he cuts out a thin slice of tissue where the original cancer was growing. Now, the key to the whole process.
This skin will be color-coded and mapped.
After the mapping and coding, the tissue is frozen in precise orientation, carefully sliced and processed into slides. Now, the crucial part. Dr. Album looks at every part of the sample, especially borders and bottom, looking for remaining cancer cells.
I just looked at Dr. Gomez's slides. There's evidence of basal cell cancer in both of the 2 pieces of tissue.
That means repeating the whole process. This time the cut is wider and deeper, but successful.
The verdict is you're a very lucky guy. All the disease is gone.
Great news, but now I've got a pretty big hole in my nose. Fixing it will be Dr. Tom Romo's job. It's a little disconcerting. I do a lot of this, and I've seen a lot of nasty-looking holes in people. Seeing it in your own nose is a whole different story. This operation is more extensive, so they knock me out with IV sedation. The question is how to fill the hole. A skin graft from behind the ear is one possibility, but it wouldn't match the surrounding skin. So Dr. Romo opts for skin flaps from the surrounding area of my nose.
The color match is the best because it's right next to that area. And 2, it actually brings in a blood supply. So it has the most chance of surviving and healing well.
After a fair amount of digging, cutting, and sewing to cover the defect, it's all over but the healing.
With the techniques of modern plastic surgery, small sutures, and a good patient, we should have a great result.
Dr. Max Gomez, good morning. Good to have you here.
Good to see you again.
It's good to see you again. Feeling okay?
I'm feeling good. Stitches came out. The cancer's gone. I'm healing.
This is an awakening, isn't it?
It really was. I mean, this thing was no more than the size of a grain of rice on my nose. I mean, that's the size it was, and I ended up with that big chunk taken out of my nose.
I want to see if they can get a tight shot. I want to mention you're not wearing any makeup for television,
right,
anything like that. The shininess on your nose is an antibiotic ointment.
Right. That's a little antibiotic ointment on it.
And
the bruising is from all the undermining that they had to do in the skin to try to get enough slack to cover up that hole.
Meanwhile, though, before and after, before the plastic surgery, is an enormous difference.
Oh, yeah. Absolutely.
You did a great job.
Yeah.
Let's get to the real issue here. the lessons learned from this? You know, I look at this and I say, I'm going home, I'm putting more sunscreen on, I'm putting it all over my kids.
That's the lesson that I really want people to take away from this. I didn't do this because I wanted people to see what I was going through. It's because there are two things you've got to remember about skin cancer. One is, fortunately, the good news is that it's very curable. Even melanoma is very curable if you catch it early enough. But the cure is going to leave you scarred. You're going to lose a piece of your nose, your ear, your forehead, eyelid, something. And it won't always be rebuildable or reconstructible like mine was.
So let's talk about checks in a second. Let's first talk about prevention. Let's get to the point we don't have to worry about those checks. Sunscreen, hats, long sleeve shirts, long pants on the golf course. All the things that we tend lifestyle-wise not to do.
Not to do. Early, sunscreen, use it early, use it often, use it liberally, reapply it all the time. But
you go swimming, put it on again.
Put it on again. You're sweating out there on the golf course, put it on again. But here's the other important thing is, you get, according to the Skin Cancer Foundation, you get 80% of your lifetime sun exposure and sun damage by the time you're 18. That's why it's so important to get the kids to wear it. Squirt it on them before they go off to camp, to go play ball, to go out on the boat, go to the beach, whatever.
Protect them so when they're 40, 50 years old, they don't have to worry about it. Max Gomez, I'm glad you're feeling all right. Thanks for sharing your story with us.
Thanks. Good to see you.
It's 14 minutes.